As total healthcare costs rise in America, people have continued to ask if there's a way to improve the system. In a 2011 New Yorker article, Atul Gawande asks whether it would indeed be less expensive to invest more resources in care for the neediest patients, a process called hotspotting. Gawande offers several examples of enterprising programs across the country that seek to do just that. Jeffrey Brenner was a family physician in Camden, New Jersey, when a highly publicized death from gun violence in his community got him asking questions about the efficacy of Camden's healthcare system. He ended up founding the Camden Coalition of Healthcare Providers to identify and help the costliest patients in the system, generally patients with chronic or recurring medical problems exacerbated by lifestyle and environmental factors. To find these patients, Brenner started with geographic data showing which areas cost the most to local hospitals, but he had the most success just asking doctors in person. Brenner has now stepped down from his family practice to run the Camden Coalition full-time, managing nurses, social workers, and others to conduct home visits and check in consistently with high-risk patients. The program runs primarily on small grants and is seeking more sustainable funding. So far, for 36 patients the coalition is serving, hospital visits have decreased 46% and their bills have reduced 56%. Another example comes from Atlantic City, where Rushika Fernandopoul runs the Special Care Center for casino workers with particularly high medical expenses. The Casino Workers Union and the Atlantic Care Medical Center enacted the center when health insurance costs for both organizations became too high to handle. The program is set apart by its health coaches, employees who come from the patient's community, speak the patient's language, and build strong relationships with patients. When one patient was asked why, after her third heart attack, she finally made healthy lifestyle changes, like exercising and eating well, she responded that it was Jayshree, her health coach, because, quote, she talks like my mother. Such individualized attention and understanding between patients and health workers has, so far, made a remarkable difference, with a 25% drop in medical costs for workers in the program. Quote, "We've been looking to Washington," the New Yorker article says, "to find out how healthcare reform will happen, but people like these, Brenner, Fernandopoul, are its real leaders." The examples of hotspotting we've seen have been relatively localized programs. What might be some of the obstacles to expanding the scale of programs that offer heightened care to high-cost patients? Are these types of programs better suited to be local endeavors?